Today, if this world is going forwards, it's because of people who can think out of the box. Karl Popper was a great thinker in London in the 50s. Once said, knowledge advances not by repeating known things, but by refuting false dogmas. One of the dogmas in medicine is, for every ill there is a pill, which is not true. So I always demolished this myth about 40 years ago and wrote a book, What Doctors Don't Get to Study in Medical School. After I wrote that book, they wanted to defranchise me, remove my degrees and all. So people wrote to the MCI, remove his degrees, remove his professorship, because he has written something very much against the medicine. No. I wrote, there is no pill for every ill, but there is an ill following every pill. When I first started the treatment for heart disease without any treatment, drugs, people laughed at me. But now they come to me, especially doctors come to me, because when they get ill, when they get a heart attack, they don't want the usual treatment that they give to others. And some of them don't want me to let the world know that they have come to me. They come quietly, secretly, and then take the treatment and go away. This is nature. Now, if today medicine has gone one step further, it is because of Pramod's effort to say that diabetes can be controlled naturally. The conventional thinking is diabetes, the minute you have diabetes, you must immediately go and have either insulin or some other tablet. And that's why the West always hypes that. I think it was Sindeji who was talking about Nobel Prize and all. Nobel Prize is given only if there is business in whatever you find out. Like for example, Banting and Best found out insulin. Immediately they get the Nobel Prize and everything happens. But insulin is the one which has probably done more damage than diabetes itself. It is hyperinsulinemia that does all the damage, because insulin is a growth hormone. So whether you produce endogenous or exogenous hyperinsulinemia, you get all the vascular complications, eyes, kidneys, heart, lung, everything is damaged. Your legs, everything is damaged. But before the insulin level goes up too much, you are okay. And that is where Western medicine has gone astray. Western medicine has gone after the wrong science of reductionism. That is, supposing somebody was talking about cancer, you would be surprised. We know what cancer is, but we don't know how to cure cancer. But we still give treatment which we know doesn't work. Chemotherapy and lot of things. And we know it doesn't work. But we still give it because it's a big business. You will be surprised to know that cancer business in America is $2.5 trillion business. And this is accepted fact. A recent study which is published last week showed that 2,500 American doctors were interviewed, and they said 50% of what they do is not for the patient's benefit, but for their benefit. 50% of angioplasties and bypass surgeries are done for the doctor's benefit, the hospital benefit, not for the patient's benefit. And when you publish this data and try to do good to people, people don't like you. You will be surprised. Now we have got a new system for treatment of heart disease. After a heart attack, we can get you back to normal with natural methods. And one of my patients, doctor patients in Pune, he has taken this forwards, one Vinod Marathe. But today I am so happy, after 50 years, America says cholesterol is a friend, cholesterol is not bad, cholesterol is good. Actually, in India, we have been treating diabetics with cholesterol lowering drug called statin. And we now know that statin pills, if you give it to 10 people, one of them will become a diabetic in 1 year time. Today in India, there are 15 million people taking statin. That means we are manufacturing 1.5 million diabetics every year. So that's why we say, oh, India is the diabetic capital of the world, because we are manufacturing diabetes. So now that America says cholesterol is not bad, I think this ghost will also go. So with Pramod's effort, the two ghosts have died in the area of diabetes. A, statin, B, the other drugs. And one other thing I'll tell you, this is a secret, don't tell others. Don't go out and tell this, and don't tell the media people. Please don't report this. Every drug that I give to a patient, there are two things you must know. A, And if I give a drug to you, it doesn't mean it helps you, because we only have statistical data. So we have a group, this group it helps. So there is what's called NNT, number needed to treat unnecessarily, to have one effect. Take, for example, blood pressure tablet. If I give you a blood pressure lowering tablet, if you have blood pressure, you don't know, I don't know that whether you get the benefit. I have to give 850 people that tablet unnecessarily, benefit one patient in the next 5 years. So that's called the NNT, number needed to treat. So when I give you a blood pressure lowering tablet, you get 1 in 800 chance of getting benefit. Okay, then you say, okay, all that doesn't matter. Even then I'll take it. If you can take it, but what's the ADR ratio? What's the risk ratio? Every drug has dangerous side effects. And blood pressure tablet is at 2%. That means out of the 850 that I have given unnecessarily, 2%, that is 16 people will die in the next 5 years of my tablet. And one man will be saved from blood pressure ravages. If everybody is told this about every drug that he or she is taking, many people won't take the drugs at all. It is because most of the diabetic drugs are dangerous. And some of them damage your kidney completely. And some of them damage your heart. Especially, some drugs, very, very popular drugs like metformin, they damage the kidneys completely. But doctors are so fond of them that they give huge doses because they just want to see the report. Patients are also happy with the report. How do they feel, whether they're alive or dead, they don't know, but the report must be nice. So they're only going after the report and saying, this is my report. And there again, we lower the report every day to keep the drug companies happy. There was a time when the PP sugar should be 180 and fasting sugar would be 120. When I was a student, that was a level. It came down gradually because more companies produced drugs, so it came down, and it came down so low that they said, okay, 180, etc., etc. Now this is all happening because of the industrial pressure. So the medical industry in the West runs the medical treatment methods, and they have the guideline committees. And recently they found that every guideline committee member takes millions of dollars of bribe from the drug companies, and they write it for the benefit of the drug company rather than for the benefit of the patient. And our doctors follow the American guidelines. I always tell them, don't follow the guidelines, because guidelines are not genuine. They are not